I'm Dr. Anthony Kaveh, here to discuss the tragic case of Francisco, a 53-year-old father who passed away in the emergency room, in the waiting room, right here in my backyard in Vallejo, here in the Bay Area in California. This is what that Kaiser facility looked like. And I want to share with you specifically what we understand happened, why Francisco's family had to call 911 while he was waiting for 8 hours in the emergency room before finally collapsing to the point where his wife, just to get attention, began to, what some people might call, act out, though I certainly understand why she would do those things. And so that you can come away knowing what specific language you can use to advocate for yourself. Some of us call them the cheat codes to get the doctor to listen to you when it's extremis, when it's an emergency, because an 8-hour wait is simply unacceptable no matter what other, what we might call organizational factors are at play. Maybe some of it's gaslighting. We'll explain why I think that might be part of it. But at the end of the day, you need to know how to advocate for yourself. And of course, there are many factors that went into this case. I don't want to blame any one person or organization in particular, but rather take away from this what you need to know so that you don't fall victim to similar potential tragedies, because let's face it, the US healthcare system is sorely lacking. And if you know what I'm talking about, please let me know below, because I know that while this might be an outlier case, it certainly is not unique. And I know there are many individuals, even people probably from overseas, that have experienced similar scenarios. So first off is gaslighting. I know this happens all over the world. Very briefly, remember that the risks are age, being too old or too young, your race. It's not lost upon us that Francisco was of a, if you want to call it, a non-white race. I don't want to victimize anyone, but I just want to say when it comes down to advocating for your health, you got to know what the risk factors are for potentially having some bias against you. And hey, guys, I'm a doctor. I don't want to overfeed or overfuel this, but I do want everyone to know what the realities are. If you're disabled, if you have chronic pain, if you have psychological or mental health conditions, these are all things that can contribute. And the one that I see the most commonly, perhaps, in the Bay Area is not speaking English. Maybe not because people purposely are trying to blow you off, because they really don't know what you're saying and can't communicate clearly with you. So no matter how crazy busy that hospital or emergency department or ICU or pre-op surgery area is, what can you clearly communicate? First and foremost, this one is so important no matter where you are. I've shared this with you before. Be comfortable saying, what is the worst thing that can happen and why isn't it that? All right, so this gentleman here, to be very clear, Francisco, from the reports, was having chest pain, was having sweaty palms. I certainly know that he and his family were concerned about something horrible going wrong, but maybe there was an inability for him to get a hold of a doctor, from what we understand in the reporting, because of there not being sufficient nurses, for any number of reasons. But what is the worst thing that it could be? Why isn't it that? If anyone with any medical understanding had been asked that question, I would say it's borderline near negligence, if not outright negligence, if they did not answer with heart attack. You don't leave someone waiting for 8 hours if they might have a heart attack and you have nothing to prove that it's not a heart attack in such extremis. So another example of, instead of saying, I don't feel well, if you're having chest pain, if you're having trouble breathing, if you're having worsening abdominal pain, I want you to hopefully feel comfortable, if it's appropriate, to say what you have. Don't let anyone guess what your extreme symptoms might be. Another very common one, I'm dizzy. This is so common in the emergency department, and it tells the doctor virtually nothing. It does not help with triaging. It is such a vague statement. And I'm curious if anyone here, I'm looking at the comments, if anyone here has ever felt this way, where they kind of feel dizzy and don't quite know how to explain what's going on. So I'm seeing here that many people, oh yeah. So I see Wendy's comment here about language in particular, the call centers, which are so frustrating. And thank you, yeah. Like Nuri is pointing out here, yes, being honest and clear is so important, especially honest about what you're feeling. So I'm sure more comments will come in about dizziness, but there is vertigo, which is the room is spinning around you. Typically, we associate. Sorry, guys, my camera here is having problems. Okay, we'll have to fix that for the final recording that goes up. Hope everyone's still with us. So I'm dizzy is, sorry, everyone. Feeling dizzy with the room spinning, what we might call vertigo, is typically an inner ear pathology. Feeling like you cannot stand up without fainting might be a heart problem, like an arrhythmia, where you can't pump blood to your head to keep you conscious. It might be a heart attack. It could be any number of things. There are certain cases of vertigo or dizziness that might be associated with a stroke. If you can more clearly articulate what's happening instead of I'm dizzy, that will help the doctor more quickly assess you, and the nurse hopefully to assess you so you can get the care that you need sooner. Another one, my belly hurts. We hear this all the time. If you could be specific about where that pain is spreading to. There is no audio. Thank you, everyone, for letting me know. This is why technology is so frustrating, but you know that it's live because a lot of that audio cut off. I want to just be very clear that because we know that age, race, not speaking English, etc., might reduce the level of care that you get. I want you to make sure that you bring someone who speaks English, a native speaker who can advocate for you. I want to make sure that you bring notes and you're taking notes on paper with what the doctor is saying, and you have notes to go home with you. If you have any question about the plan, it is your doctor's job to give you a clear plan. The doctor, we don't always know everything, but it's not an excuse to not answer your questions and at least give you a plan so you know what to expect, especially things like that we call return precautions. It's very important to bring a written list of your medications, your allergies, and your conditions so that we can more quickly triage you so that we don't spend valuable minutes trying to gather this information. If it means you keeping it in your wallet at all times, then do it. Keep it in your wallet so that we can help treat you faster. And remember that you don't want to abuse the cheat codes, but if they're accurate, you want to drill them home. If your heart or chest are in pain, you have to speak up. Brain or your head, you have to speak up, right? Heart attacks, strokes, these can kill you in very short periods of time. I don't want to be overly dramatic here, but it's inappropriate to let someone wait for more than half an hour, 2 hours, certainly not 8 hours. Remember, this individual, Francisco's family called 911 while he was waiting in the emergency room. And the paramedics, the first responders said, there's nothing more we can do. You were already at the hospital in the emergency room. This was before he collapsed and passed away shortly after. So severe abdominal pain is another one of these red flags that you need to be comfortable speaking up for so that you hopefully do get seen at a timetable that's appropriate. So now that you hopefully can hear me, let's see. I'm happy that we were able to get our audio back. This is all live. And when technical difficulties happen, we try to do our very best. Hey, CyberDoc, I know this is incredibly tragic. I don't want you to be in the headlines. I'm not saying that, once again, this alone will solve all the problems, but it sure as heck will not hurt to advocate yourself. You don't want to necessarily be the squeaky wheel, but if it helps you get the care that you deserve, then you got to squeak and you have to speak up for yourself. This is so sad, Jody. I agree. Let's launch into our Q&A now so I can answer your questions. And my goodness, Elaine Carrier, I'm a double heart valve patient. I've been seen in the ER as long as 6 hours. Well, being in the ER for 6 hours is one thing, but being in the waiting room of the ER is different. That's where this story took a south, or a left turn. This is important information, and if you don't have it ahead of time, it's hard to come up with it in the moment in extremis. Linda waited 5 hours with a broken ankle. My goodness. And this is where it's like, a broken ankle is terrible. We all agree. Compared to the person who's clutching their chest with chest pain, there's a triage or a prioritization that has to happen. And this is the reality of medicine. Hey, Alouette, hello back from the San Francisco Bay Area, and from Denmark. Good to see you, Stephanie. I'm happy that you can all hear me now. At Kaiser and Vallejo, you have to be the squeaky wheel. Yeah, you do have to be the squeaky wheel, and probably in more places than just the Vallejo Kaiser. Did he even make it back to a bed, Candy? I don't believe he was seen by doctors until he collapsed. And I think it was about 30 minutes after which point he died. And what heart issue causes extreme skin pain? I don't know what you're referring to. Sorry, Margaret. Jean, good to see you here. Waited 5 hours in an almost empty ER. I am so sorry that you had that happen, but this is the reality. If you don't know how to get the triage nurses or the doctor's attention, things might wait. Sometimes it's appropriate to wait if there are true emergencies ahead of you that are prioritized higher. But if you can advocate for yourself, no one's going to read your mind. I am an anesthesiologist. We spend a lot of time in the emergency room. I'm not an ER doctor myself, thank goodness, because it's a very, very, very stressful job. And Gabby, good to see you from Norway. The ER wouldn't let me go to triage with my husband. See, Benson, this has happened a lot recently. It really started with COVID from my experience, and for many reasons is still persisting to this day. I don't want to speak on different hospital institutions' policies, but there are many reasons why some places might not want to have more people in a busy ER. So acute pancreatitis, says Stephen here, sat in the waiting room for 10 hours before I got into the ER and a bed. Took forever to get any relief. So acute pancreatitis is one of the true emergencies in the abdomen that needs to be seen ASAP. Other abdominal emergencies can be an abdominal aortic aneurysm that's leaking or bleeding. There's a couple other things that can be truly life-threatening in a very short period of time. But you had one of them. I'm sorry that you had to wait for so long. Heart of Nixie. Urgent care sent me to the emergency room years ago, probably 10 to 11 hours. Waiting was nauseous. My goodness. I'm sorry that you had that long wait. Wow. And ragdoll of sin. Yeah, I collapsed in a room. Once I got back there, all I remember was coming to with a nurse, lightly kicking my foot, saying, "Stop being dramatic." And I was diagnosed with a lot. Well, not productive to call a patient dramatic. This is why I want you to feel comfortable advocating for yourself with specific words, clearly communicating what it is that's going on. If I am so faint when I stand up that I might pass out and fall over and hit my head, I don't think that's being dramatic. It has to be within the context of everything else being treated. Hopefully you've been hydrated. Your heart does not have any problems. You don't have any other symptoms of a stroke. That is so much more productive to rule out and discuss before calling someone dramatic, to say the least. Has anyone else ever been told things like this? I'm very curious because I'm sure that it's not just ragdoll here and others. When I was 9, mine burst on the way to the hospital. I was in the hospital for a week. I wonder if you meant your appendix, or I'm not too sure person what you're referring to, but it doesn't sound pleasant. Gabby knows exactly what we're talking about, and Lauren's talking about acute pancreatitis several times. Now, this might happen a little bit more frequently with medications like Wegovy and Ozempic, because the GLP-1 agonists increase the relatively low absolute risk of pancreatitis. It's like an 8-fold or so increase. It's still a very, very small number. Don't quote me on the exact percentage increase, but it is actually quite high. It's still an absolutely low number, but one that we absolutely need to know about. Sorry, person, about the burst appendix. Bowel obstructions are another emergency in the operating room that need to be addressed, especially because your lactate levels can go through the roof. And that can lead to all sorts of decompensations in your body if not addressed very urgently. Saraswati, I'm sorry about your brother and pancreatitis. And Kevin, I wouldn't blame you for being terrified of hospitals. After everything we're talking about, the goal is not to scare anyone, it's to give you concrete goals. That's what we talked about in the beginning of this video. If nothing else, remember to ask your doctor, what is the worst thing this could be? And why isn't it that? You deserve to know. It might be above your literacy level, but you still need to have it explained to you in a way that helps you understand so that you are clear and have confidence in the hospital system. Otherwise, you have individuals sharing what Kevin shared, and it's simply not appropriate. You're very welcome, Saraswati. I'm not scared of hospitals, I just don't like them. Well, I don't like them either. It was serious enough to put me in the hospital for 2 months and require surgery. Yeah, we have had a lot of people talking about these conditions. My goodness. And Jody, who? My husband was medically complex. He carried a binder with any info. Exactly. You want to carry something, whether it's a binder or if it fits in your wallet, carry a list of all your meds, allergies, medical conditions, so that you get the care you need faster. I believe have more power over your health than you've probably ever been told. Until next time.